Some of the ways to help recruit and retain minority nursing students is through the HASA Fund, academic advisors, faculty support and mentor support, weekly and monthly meetings, and student success centers. I also did a second article which was by Bukes and Nolt, and it came up with 4 guidelines. The first guideline was about communication, second was facilitating attitude, the third facilitating respect, and facilitating clinical accompaniment. So the guidelines had 3 main themes, mainly value-sensitive communication, respect during clinical accompaniment, sensitivity to quality of clinical accompaniment. Guidelines included 3 main parties, mainly the lecturer, students, and the patient. So the first guideline, which talked about communication, talked about creating an atmosphere of trust and respect, open communication channels. Communication should be 2 ways, verbal and non-verbal communication. Non-verbal communication is very important. Using simple words and terminologies and use of interpreters. Sometimes we have patients who do not speak English, say they speak Spanish, so there will be a need for a Spanish interpreter to explain to them. The second guideline was about attitude. Nurses should have an open-minded, not be judgmental and unbiased, reflect on their own values, be sensitive and caring to the patient, basically have empathy for the patient and communicate with patients on a level that patient will understand. The third guideline was about respect, facilitating clinical learning environments, especially for the students. When a student is following or doing a clinical rotation, nurses should respect the students, acknowledge students as human beings, protect patients' rights, especially their information, say their social security numbers, the addresses, make sure they protect them. And nurses need to update patients constantly on what is going on, the plans for patients during their stay. The 4th guidelines was about clinical accompaniment, meaning nurses must expose students to clinical opportunities. Say where there's going to be a surgery or something, they should make sure they allow students to be in the operating room and be part of the program. They should also enable students to take active part, hands-on demonstration, and correct techniques and step-by-step methods of doing things. So I have a question. How does the use of non-verbal communication affect nurse-patient relationship? And if anybody here can describe to me their most negative experience during clinical rotation?
I have one. I'm in the nursing program, and we had clinicals at a hospital. And the lady that I was supposed to be shadowing, anytime I asked her a question, she just had negative things to say, or it seemed like she had an attitude, or she was ready to go home. That alone threw me off and made me hesitant or not even willing to learn, because I knew that she was not willing to teach me.
Wow. I think I've had that experience before. We've all been students before. So the healthcare providers, which means nurses, doctors, lab technicians, pharmacists, should all have knowledge about other cultures. They shouldn't be judgmental or be biased. Know dietary practices of other cultures. Be informed about rituals and practices of other cultures, and value diversity. So I came up with a LEARN model for cultural diversity. This basically means learn. And the L means listen with sympathy to the patient. E means explain perception of the disease to the patient. Acknowledge and discuss differences and similarities to the patient. Recommend treatment, don't force it on patients what they have to do, and negotiate with the patient. In conclusion, the research article partially supported and answered the paper question. Healthcare improves quality of care, it enhances cultural competence, expands access to services for minority patients, and diversity affect nursing students' retention. These are some of my references, and anybody here has any question? I actually have a question, and I'm going to pass it around for everybody to feel free and say whatever you want to answer. Thank you so much, everybody, and thank you for coming.